You're joining us today for the Early Access to Mobile Care app for Parkinson's conversation. This is also sort of like a focus group. We want this to be interactive today. We're going to be talking about some of the challenges that you have navigating living with Parkinson's, navigating the healthcare system in the world, planning your day, dealing with appointments and medications and all of the things, and how technology, we're relying more and more on it, and how there's the opportunities always for new technology. And today we're going to be talking with two folks from Adley Health that's going to be talking about an app that they're creating to help coordinate the care, medical records, finding providers, scheduling your calendar appointments, all of the things that make up your day, to try to organize it, make it easier and more streamlined, and hopefully add a little bit of more space and margin into your life by making things easier. So I am excited to introduce to you two folks today. First, we have with us Morgan Fixel. She is the technology leader and founder of Adley Health, which this work is very deeply personal for her. She is also living with a family member with Parkinson's. I'm sure she'll share her own story. And it has also shaped her decades-long experience caring for this person, which is her father, and the many challenges that has come in her own personal experience of navigating all the care and all the things that are required for someone living with Parkinson's. And then also with her is Mick Hill. He's the CTO and co-founder of Adley Health. And they're both going to be talking with you today. And they have a presentation, but there's a lot of interactive stuff. So have your phones ready, because there are some QR codes that you guys can scan, and there'll be some interactive things. And then if you need to, you can also drop the comments in the chat, your questions in the chat, and we'll address those as we go. But I'm going to go ahead and hand this over to Morgan and Mick and let them take it away from here.
Thank you so much, Anissa, and thank you so much to the PMD Alliance group. We're so excited to be here to talk with you all today. And so, as Anissa mentioned, there's going to be some interaction within this presentation. If you don't feel comfortable scanning the QR code, Anissa also suggested that everyone can just write into the chat. So happy to meet you wherever you are today. Do whatever feels most comfortable to you, and excited to run through. Let me go ahead and just share my screen. Okay. Can everybody see this okay? Okay, wonderful. So who are we? So as Anissa mentioned, my name is Morgan, and I am the co-founder and CEO of Adley Health. I have a background in building technology for over 15 years. I really came across this because a lot of my career has been in building early stage products for companies like Google and Uber. And what I started to realize in a lot of that experience as I was starting to manage my dad's care is that there was nothing really to carry me from the very beginning all the way through. It always felt like we were switching systems. And Mick and I were actually on the phone, and I was like, oh man, if only I had this one thing, it would make my life so much easier. And he goes, Morgan, you're working so hard. If you need that, I'll just build it for you. And 4 hours later, he built me something that my family started using regularly. And it was the easiest thing. And I said, maybe there's something here. And that's really where we got started. But outside of being a caregiver for my father, I am a mom. I'm an advocate within the Parkinson space. I love to give my town council a very hard time about still using pesticides on kids' fields. And so I'm trying to really make a difference, not just for my family, but for as many people as possible, given my experience. Mick, over to you.
Yes. Hello, everyone. Mick Hill. I've been building technology for 25 plus years in all industries. As Morgan mentioned, it was just kind of like a one-off thing that how we happened to get into this. So it was really amazing that we could do this for her family and make an impact for everyone else with that. Yep, got two little boys, beautiful wife, and I'm probably one of the more rare Colorado natives, because you never see those anymore. So with that, but I'm excited to be here with everybody.
I'm a Colorado transplant. That's what he's referring to. Okay, so we'll just dive in. I would first love for everyone to take out their phones or again, go ahead and write into the chat. And I will go ahead and open this up really quick. Sorry, 1 second. Need to collapse this window. This is great. So I think some of you can see the responses on your end, but if you're curious, I'll read out some things so maybe everyone feels like they're not alone in some of their responses. So coordinate with my provider app via my chart, medication reminders, symptom tracking, exercise tracking, a hub, a one-stop shop, tremors when I'm feeling out of balance, routine reminders. For notifications such as eating, taking meds, drinking water, etc., if food choices for Parkinson's disease. Definitely some great responses and excited to kind of get into some of those specifics later. We'll go on to the second poll for now. So let me go ahead and open this one up for you. So what are the biggest hesitations in using a technology tool to help you with your daily care? Okay, this is all really, really helpful. While this last person is typing, Mick, do you want to just quickly touch on what we are doing for privacy and talk to that?
Yeah, so we we are following the guidelines for HIPAA privacy one, but we also are going through SOC 2 audits to make sure everything is locked down, penetration testing. So we're getting the A grades for all of that so that all the data is secure, safe. Um, and we're getting that on a regular basis so that everyone's information is safe and secure. And then also it's only available to you and then whoever else you share with your care circle. Um, so we are constantly going through security protocols about every 6 months with that.
And Mick also is we're doing encrypting. Whenever something is being sent, everything is encrypted. So we don't have access to anything. It lives on your device. It lives in a cloud storage. We can't see anything. And everything is completely secure. And I saw that one person says clearly stated data that it will not be sold or used for research unless opting into that. And actually, that's a pretty big thing for us. And we spent a long time thinking about our business model and how we wanted to also help people within this within the Parkinson's community. And we will not be doing any kind of sharing data of any kind. Maybe there is an option in the future if we wanted to, but that's not something that we are really planning on. And so for that, this is not a free app. But what you'll learn is that free apps generally need to make money somehow. And so they generally will sell data. And that is not at all a part of our plan. And so we want to be really upfront about that. And the dollars that you're spending are also helping to make sure that like privacy is first and foremost within our thinking and within our database. So I do want to just touch on that because that does come up in most meetings. Okay. Any questions about that? Otherwise, we'll go on to the next question. Awesome. Are you using any tools today? And what do you like or dislike about those tools? Okay. Wonderful. So let's hop in. Let's talk about Adley Health and what we're doing. So we're really coming at this from a very specific angle. So as I kind of started with, my dad has had this disease for 30 years. And so I have seen everything from the beginning when he was independent for a long time to needing some partial care to needing 24-hour care. And what I really realized in this journey is a few things. One, there is no system that really allowed to follow him regardless of whatever he was going through. There was no system that allowed us to really allow people to tap in and tap out as needed. And so people could get actual real breaks, or even my dad could get a break in setting the alarms on his phone for his medications. And that's something that we really wanted to build towards. And so, what we're trying to figure out is like coordinating care on a really, really deep level where it's more than just updates or messaging. These are tasks that people can actually take on if you need it. People can help out in acute care situations, and you can actually also do a better job of tracking things in one place so that you don't feel so scattered within your care, which generally means that you're going to end up going back to Excel sheets or emails or notes or whatever you might want to do. And so what this ends up looking like is Adley is really building this app that does all of these things. So you're probably already letting people know things over a group message. You're probably letting people know updates when you have a doctor's appointment in your My Chart. And so we really want to make sure that everything can happen in one place instead of in separate places. Today, what the app looks like, where we are now and where we're going. So you'll see if you were to download the app today, which I will send an email to the PMD Alliance with a code for anyone who has joined today or who RSVP'd. And so you can get a promotional code to download it and try it. Where we're going, you'll see that today we have a dashboard that is really around actions. And so the home screen really does hopefully help you to kind of track everything throughout the day in terms of medications. It will add to-dos. And so if you have to track vitals, if you have to track, if you have to, order new medications, whatever it might be, all of that will be there within the to-do tab. And then eventually you'll also be able to add other care partners to the app as well, so people can have visibility into your daily care. Within the app, we also have an emergency plan. So this is this hospital kit. So it's really clear about what it is that you want. And I know that this is a topic that most people don't like to touch on, but I can't stress enough how important it is for all PD patients to really have an emergency plan set. And so when you are in the hospital, you know how to patient advocate for yourself, but even more so, the people around you who might be helping also know how to patient advocate for you. And so, simple things like you want to take your pills on time. And so you actually want to take your pill bottles with you to the hospital. Any of those details you can put into the app. Assignable to-dos. So this is actually coming up in a very close release. So we don't have this today, but we will have this within the month, where you'll actually be able to assign tasks to other people. So if you have a spouse or a child or a friend that can go pick up a prescription bottle for you, or can run an errand or take you to a doctor's appointment or whatever it might be, you can put those tasks in there. And so everyone knows when it's happening, and exactly what the task is. Care Circle, this is kind of going to that contact book that I've been referring to. So you can add as many people into your Care Circle as you want. And so the way in which we work with our patients currently is we charge just per once patient profile on a monthly basis, and then you can add as many people into your Care Circle as you want free of charge, because the idea is that you should have as many people around you to support you in your care, no problem. And so we will never try and gate how many people have access to your information if those are the people who you want to have access to your information. And you can set permissions for all of those individuals as well. So if you have like a neighbor who might need to have access, they're going to have very different permissions from maybe like a spouse or a child who you might want to have more details or information. Medications. And so I'm really excited. I wish I could show you today what this exciting new update is going to look like. But this month, we're going to have a pretty big enhancement and rollout of our medications. And so you'll be able to, one of the things that we heard from early beta users was that just putting all the information in as it exists today was just a little cumbersome, especially when you have potentially 10 medications to take in a day. And so we are completely redoing this. So you'll be able to scan the medication bottle. You'll be able to easily note what is as needed versus what is scheduled. We'll also have tapering and titration. We'll have lots of really exciting features. And then as you get alerts, you click on taken, missed, or snooze. And then all of that will actually allow you to then create a chart. And then within that chart, you'll be able to see medication adherence overall by specific medication, by time of day. And we're hoping to find really, really solid ways of getting to this on and off tracking via adherence data, because I know that that's a big pain point for people. And then lastly, this insights piece. Insights is something that everyone has kind of mentioned symptom tracking. This is something that will live within there. So symptom tracking, you'll be able to actually track after you've started a new medication. How are you feeling? It will give you specific symptoms potentially. Depending on the medication, we'll definitely be doing it for Parkinson's meds. And then you'll also be able to track just anything else. Are you feeling better? Are you feeling worse? Are you staying the same? And so that way, when you go into your doctor's appointments, you feel really, really confident about the information that you're sharing. I just talked at everyone a lot. Any questions or any thoughts or comments? I would love to hear. Otherwise, I can keep going.
Other than the first one that just came up, cost, but you might be covering that. So
yeah, so cost for the app, it's going to be $20 a month per patient profile, and then you'll be able to add as many people as you want to your profile free of charge. And all of these new features that are coming out will be included in that cost. So we won't continue to increase cost. If you need more complexity within the app, it will always stay the same price for you.
So you mentioned the care circle. I was curious, do those folks have to also download the app and join, or are they notified outside of the app?
No, so they'll have to download the app. So the way that it will
Okay.
work is you'll create an account for yourself or for someone if you're a care partner. And then you'll be able to actually invite people to your care circle. So as you add contacts into your care circle, you have the option of inviting them. And then when you invite them, they will download the app and then put in the invitation code so that they have access to your profile.
And those and those users in the care circle, they are not charged as part of it.
Correct. So I'm not sure if you can really tell, but this has very much so been a community effort. This is originally was kind of born out of my idea of what I wanted, but has very much so been a community experience. So we've interviewed over 500 patients, families, and clinicians. We want to continue to hear from people within the community. What is it that you would want? What could make this better? We're only going to get better as you share information and feedback with us. And so if something isn't working the way that you want it to, here is my email. If you get my email, you also then have my cell phone number. I really encourage you to reach out to me, and I mean that. I really want to hear from everyone in terms of how we can make this better, how we can improve it, and how we can make this an easier journey for you and your family. And then join a focus group. And so if you liked the format of today, we will be doing more of these types of meetings. And so you can email me here. You can drop your email into the chat, or as I mentioned, PMD Alliance will send out an email to everyone who registered with a code and my information, and we would love to hear from you that way as well. Okay, that's it for my presentation. So I'd love to hear any questions that anyone might have. Happy to answer any questions. Here, so does it communicate with some of the doc apps, MyChart UF? So we actually made a decision to not integrate with these tools, mainly because a lot of these tools today, as they exist, they don't really do a great job with cataloging data in a way that's actually useful. And so it's generally like big areas of text. And so what you'll really notice within Adley is we're trying to make text and information live in very specific ways so it can turn into data to work with you. As a part of that, we'll be able to create a PDF for you. And then within that PDF, you can go ahead and share that with your doctor via your MyChart or via email or whatever you're most comfortable with. And Brian, I see you mentioned, you asked about HIPAA compliance. So happy to just call that out for everybody here as well. So we are not required to be HIPAA compliant because we are not a medical facility, but we are still following HIPAA compliance regulations because we do want to make sure that clinicians feel really good about this information as we're collecting it. And the more we do that, I think the more everyone will end up wanting to use it and trust the information within it.
One of the things that I'm impressed with in this app is, and I'm thinking from the care partner perspective of, having people say, oh, let us know if you need anything, how we can help. And, it's just so hard to pair that up with some tasks that actually translate into action. It's just one more thing to have to do. And, then care partners often end up just continuing to do and more and get stressed out as they're helping their loved one. And this has such a nice, easy way of, giving people from different levels of care, the opportunity to engage and help out and be assigned tasks and all of that. So I think that's a lovely aspect, not only in just management, but just also helping from that perspective.
Thank you so much. Yeah,
And you're
again,
being asked, or if you're related
yes,
to the Morgan
guilty is
Fixel.
charged. So if you haven't been using the app and if you walk into the center, my dad will look down on you when you walk into the center. Well, thank you guys all so much. If there's no other questions, I guess we can end early today.
Obviously, we can end early. We never keep anybody any longer than they need to be, but we certainly will give you a chance if you have any last minute questions and you just hesitated. And as Morgan said, we will send you an email with the information so that you have that, then follow up from today's program. And yes, if you want to save the chat, you can certainly do that as well, but there's some information that's been dropped in there. So I'll give them a second just in case someone is typing
Take
their
your time.
question. How long did it take you to put this together?
So it became an idea last April. We started building in July, a lot of the back end architecture. And we started doing beta testing in, was it November?
Yeah, late November.
So yeah, and so now we're live in the App Store as of a couple of weeks ago, which is very exciting. But we really took our time to get into the store to make sure we were getting as much feedback as possible. And we could keep pushing, not being in the store, but we're really happy with the product that is out there today. And I promise you, it is only going to keep getting better based off a lot of feedback. So if it's not perfect today, I really do encourage you to stick with us and reach out to tell us any features that would be most helpful for you.
And to answer Ron's question, I think, Morgan, you're going to be sending us everything that we need so that you should be able to get that email today.
Yes.
So you don't have to wait too long.
Well, thank you all for being early believers. We really appreciate it and your curiosity and engagement today. It means so much to Mick and I. And we're excited to follow up with a code soon. And as we've said a few times, reach out anytime.
We thank you guys for sharing what you've done. I am impressed with what you've built already in such what seems like a very short period of time, and already you're adding to it. So congratulations for that.
Thank
And
you
thank
so
you
much.
everyone for joining us, and I hope you guys can get started on it and let us know how it goes. Thank you very much. Have a great day.
Thank you.